Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. CHA2DS2 VASC scoring for risk of stroke and the oral anticoagulation need in case of the AF. So first let's look at the components. The components is as the name suggests, so C for the congestive heart failure, and then first let's look at the components and then we'll discuss the scoring. Then H for the hypertension, A for the age that is greater than that of 75 years, then D for the diabetes mellitus. Next comes S, which includes the stroke or TIA or the TE. Next comes the VASC. So VAS, vascular diseases. So vascular diseases is prior to the MI and peripheral artery disease. What is prior to the MI as well as the peripheral artery disease, or you can call that as a aortic plaque. Then comes A is for the age of 65 to 74 years, and then comes S, which means the sex category, that is in females. Now let's look at the scoring individually. So when we spoke about the C, that is a CHF, it has 1 point. It will congestive heart failure. So before we move on to that, let's look at there are two categories which have 2 points. So it is the age. The age has 2 points, and then the VASC, that's a vascular diseases, this has 2 points. The rest whatever we are seeing is all 1 point. So hypertension 1 point, diabetes mellitus 1 point, 60 to 74 years, this will be 1 point. Then the next is the sex category, this is also going to be 1 point. Now let's look at the influence of the antithrombotics. So here in terms of antithrombotics, we have the CHA2DS2 score. So in terms it is 0. So in terms of 0, what about the rule of the antithrombotics? So in terms it is 0, it means there is aspirin or no antithrombotics. So you give the aspirin, or there is no antithrombotics. Next, if you look at score 1, it means it is aspirin. So there is aspirin or the oral anticoagulant. Then when you go above score 1, it means the use of the oral anticoagulant. So 0 means aspirin or no antithrombotics, 1 means aspirin or oral anticoagulants, and greater than 1 means oral anticoagulants. To learn and grow daily like this, please do subscribe.